Hello and welcome to HD Live. I'm Mabel Jong. IDWeek, the annual meeting of leading infectious disease experts worldwide, just wrapped up. For some of the key takeaways and data on a range of infectious diseases, including COVID-19, I'm so pleased to welcome Dr. Inger Damon of the CDC and Dr. Thomas Talbot of the Vanderbilt University School of Medicine. Both served as IDWeek chairs. Great to see you.
Thank you.
Thanks. Good to be here.
Let's start with you, Dr. Talbot. Every year, a lot of ground is covered during this particular meeting. What were three of the biggest takeaways from this year's conference?
Yeah, Mabel, I think we couldn't avoid COVID, and actually the three takeaways for me really center on COVID. So the first was just the emerging science in just a few short months of issues related to COVID, whether it's the epidemiology, treatments, vaccines. So for example, understanding more about post-COVID syndrome and the recovery of our patients. So that's one. I think related to that too was the ability of our colleagues to help answer and further that science. And so not just the impact within COVID, but in other areas. For example, some of our colleagues in the VA found that during COVID, they've actually noticed a step backwards in terms of their antibiotic usage, in terms of more antibiotics are being used, and suggesting the impact of COVID, not just on our patients, but on our quality infrastructure and other unintended consequences of COVID throughout the healthcare system. And third is a little bit of a selfish internal one, but I think for those of us in the field of infectious diseases, IDWeek is our premier meeting where we share science, we network with each other, and we weren't really sure how to do that this year. And I think to me, a big learning was the ability to have everyone across the world share that science, network virtually, do things like a 24-hour across the globe learning. That is a learning to me to take forward on how we can better interact and communicate with each other in science in different ways for these kind of forums. So it's a little bit of a unique learning, but that's another one that I thought of.
Right. And that event that you talked about was called Chasing the Sun, which was a gargantuan task, really producing that. And Dr. Anthony Fauci helped kick off that 24-hour global event that focused on the COVID-19 updates that you referred to. And former CDC Director Dr. Tom Frieden capped the program. Both offered stark assessments that the pandemic is nowhere near over. Perhaps we're not even halfway through it. Dr. Damon, are we still to see the most difficult phase?
So I think it's really hard to say. I mean, we're certainly seeing case counts climb in the United States. So we're over 8.7 million cases, over 225,000 deaths as of today. It's really dependent on so many factors, which I think both Dr. Fauci, Dr. Frieden, and numerous speakers talked about. So will individuals in our society follow recommendations to wear masks, to socially distance, to wash hands, so the 3 W's as Tom would call them. When we have the availability of a vaccine, uptake of the vaccine once it's available. And so all of these are factors which will affect, when we may be able to get back to more of a normal environment that we're used to.
Well, Dr. Talbot, let me go over to you with this one. Infectious disease physicians have been pretty much training most of their careers for perhaps a virus just like this one. What is preventing these experts in your community from containing COVID-19?
I think like every new emerging disease doesn't follow a script. So I think a good example with COVID was very early on, we didn't appreciate the role of asymptomatic spread. So people without symptoms and how they can contribute. And so we're learning as we go. I think that's a challenge for our public to see. I don't understand why we're recommending something now that we didn't before, and as science is evolving. And I think really it's been, when we say the healthcare providers, it's really now all of us. We're realizing the importance of we're all in this together to help control this, not just the healthcare systems, but all of our colleagues and patients to do those things to help mitigate the spread. And we're learning as we go. And people have to understand messages may evolve and change as science evolves. So I think that's been the learning. There's no script we had to really follow.
Mm-hmm. Dr. Damon, Dr. Fauci is now advocating a mask mandate. What would be the difference in a mask mandate environment versus no mask mandate?
So I think I think Tom actually presented some nice data on this in the end of the Chasing the Sun symposium, and really showing that countries that had instituted mask requirements quickly after disease was recognized in their country had a much more rapid resolution and control of the disease. And similarly, that when masks were used, that you saw that the morbidity and the mortality associated with COVID was also less in those countries, which had wider acceptance and wider use of masks. So certainly there's hierarchies of masks and ones that work better, but even a simple cloth-based mask appears to show benefit in preventing spread of disease. And again, this is one of those things that we learned as studies went along, and I think it's really the importance of that, asking those scientific questions during the course of this response, and then sharing that information as soon as it appears credible and is validated.
Mm-hmm. Okay. Dr. Talbot, other than the public health measures that people should follow, how can federal and state governments go forward from here to support healthcare workers' containment of the virus?
I think what's really important and what we're learning from other countries is I think we need to have a unified messaging and response across the country. I think where we've had challenges is different states, and even like within my own state, counties are doing things a little differently and messaging differently in different data. And to the lay person, even to the lay medical person, it's very confusing to really understand, are masks making a difference? What exactly are the trends? So I really think what we have not really done so well to date is we haven't really had this elevated unified national kind of attack and platform to do this. Mm-hmm. And I'm not saying everybody has the same interventions, but maybe where areas are hotter, they do some things, and it's similar messaging and similar understanding, and look at the science. I think that's where we really, I know that healthcare workers in particular are getting tired and emotionally drained, and they really want to see this end too. So that would help, I think, them as well.
Now, in the early days of the pandemic, there was a lot of anxiety about whether the control measures recommended by the CDC were adequate to prevent infection in hospitals. Dr. Talbot, what's the update? This is your area. What's the update on infection prevention and control in hospitals now, and also for clinics and doctor offices?
Absolutely. So there's been a lot of reassuring data now coming out showing that the protective equipment and precautions put in place in hospitals are actually very protective. We're not seeing widespread outbreaks among healthcare workers attributed to hospital exposures or clinic exposures. And even when we see them, it seems to be more related to community exposures or gathering in break rooms, for example, where you may let down your guard a little bit. So it's actually been very reassuring in that sense, but also, again, emphasizing don't forget those precautions when you leave the hospital. So actually, that's been something that's been both at the meeting and before that, some good evidence to help support that.
Mm-hmm. And also, Dr. Damon, do you have something to add that perhaps physician assistants, nurse practitioners, and doctors should know in the way of altered protocols, what we've learned from dealing with COVID?
So I think there's lots of good information out there. So certainly the CDC website is updated with information as it becomes available and is reviewed collectively. IDSA has been putting together a number of weekly updates in terms of clinical information, which also covers the latest of what we know about disease transmission. So I think those are all good sources for people to access.
Mm-hmm. And at the meeting, were there novel tools that were talked about that are available now to track disease, and perhaps these tools can predict outbreaks, hotspots before agencies?
So I think the prediction is always the challenging part, and I think that what everybody would love to have, but instead it's really, we're really based on what we know from other pathogens that have similar profiles, the commonalities of how certain respiratory diseases are transmitted or transmission dynamics of related diseases that we really rely on in general. So I think in the emerging viruses section, I think what we saw is some of the common themes about disease emergence really often are related to how we as humans interact with animal species or interact with our environment. So really that One Health approach. And that is likely what was involved in the initial emergence of this disease. I think there's lots of new tools that are being developed to help us track and understand the spread of disease. And so I think the whole genome sequencing, molecular genetics are going to be really important tools. And how some of these more novel tools like cell phone tracking data and that sort of stuff, I think that's going to be open, and we hope to see good evaluations of what that sort of data tells us.
Yikes! We do not need another anything. But Dr. Talbot, are there any new outbreaks that the community is concerned about and think could become a challenge for doctors across the country?
Yeah, I think what we're seeing with regards to COVID are those factors that would drive increased risk. So gatherings in close contact indoors, maybe doing activities like singing or other things that make you more deep breathing and other those exposures, not wearing masks. There seems to be now an increasing pattern for those kind of gatherings to be increasingly concerning for either super spreader events or spreading. So again, it seems basic and simple and repetitive, but reducing that risk by avoiding those exposures, wearing your mask, distancing out, thinking of things that may be higher risk, like going to bars where your masks are down and you're maybe disinhibited and crammed in together, would be something that we really need to avoid for a little while.
How long? You want to take a stab at that, either of you?
If I knew that, I would go buy a lottery ticket, honestly. Unfortunately, I wish it was over yesterday. It's not going to be. And I think the real answer to that question is dependent on the vaccines and therapeutics we develop, how effective they are, what this looks like into the spring and summer. I do think we'll learn some things that we'll continue on with. So a good example would be, we all were pretty bad before this about coming to work while we're sick. I think now we all have a different perspective of that. And hopefully as we come out of COVID, may think differently about that for any respiratory illness or other illness. So I think there'll be some silver linings too with this.
Dr. Damon, you closed out the meeting with a presentation on smallpox, recognizing that it's been 20 years since that disease was eradicated. Why was it important to highlight its significance, and how does it provide context to what is happening now in our battle with COVID?
So I think there's a lot of lessons that can be learned from smallpox eradication, and a common goal that's set, and it's a global goal. And I think it's the goal that's here with COVID-19. We may not be trying to eradicate the disease. That may not be the initial goal. That would hopefully be the ultimate goal, to your question about whether we will continue to see this, or is this going to be one of the more a common circulating coronavirus strain like we have other circulating coronavirus strains. But I think it's really that, I think the lessons from the smallpox eradication, which was declared eradicated on May 5th, 1980, so 40 years ago, those lessons are very similar here. So the importance of surveillance, the importance of good data, the importance of sharing that data in real time, the importance of doing research, understanding interventions. So which form of vaccination and providing vaccination works best? What's the quality of the vaccine? How is it stable? What tools can be used to make it easy to administer? And so the bifurcated needle was one of the innovations and developed, which made the vaccine very easy to deliver. You could have, community members, school teachers could all be taught easily to administer vaccine. So those types of questions, the isolation of persons who are ill to prevent disease transmission, the identification of contacts of people who are contacts of cases and following them, giving them guidance, supporting them, so that if they do become ill, they can rapidly go be in isolation and tested. So a lot of those, and the communication, the health disparities, all of these things are common of what we're seeing in COVID-19 as well. So there's much to be learned in terms of, and here is a success. And so I think it gives hope that we can come together, develop some common messages, common tools, communicate that to our patients, to our communities, to our counties, states, and achieve success.
All right, Dr. Ingrid Damon of the CDC, Dr. Thomas Talbot of the Vanderbilt School of Medicine, thank you to you both.
Thank you.
Okay.
And thank you for joining us for this session of HD Live, the streaming video service of Health Day News. For more health news, remember to check us out at live.healthday.com, on our Facebook page at Health Day News, and on Twitter at Health Day Tweets. I'm Mabel Jong. Have a safe and healthy day.